So there's many international professionals here, and well, the first thing I wanted to do is to introduce myself and explain why I'm here. I'm a health psychologist, a neuropsychologist, and together with my colleague, we are in the neurodegenerative illnesses and rare illnesses side of the official college in Madrid. So for those of you in Madrid, this Thursday we have an activity in which we will talk about the psychological engines in rare diseases in kids and youngsters. It's going to be in the official College of Psychology of Madrid. So you're invited to it. I have my national certificates in psychology and social intervention, and I've worked with different associations in the process of adaptation, which is what we are going to see along this presentation, to favor the different mechanisms to help face the daily life. We've seen in the first presentations the micro perspective, and now it's my turn to talk about more about the daily life. Now I work in the psychological committee in the neuropsychology side of the FEDER. So first of all, we're going to see what's psychology and how we are going to address this in rare diseases. Why is it important among our sector? Then the goals. I think I'm going to be fast on this because we're a bit delayed. We are want to go to have lunch. And I'm going to focus myself in this last two elements, which is the process that the families undergo when they enter into this sector of low prevalence illnesses, and all of the psychological side of the process. Lately, we will take a look at the environment and the person. So what's psychology? The first thing is that it's a science. It's a science that studies the behavior, the feelings, the emotions, the thoughts, the mental processes, and how this is related to the environment. It has a part of evaluation and another one of treatment, a treatment that has to be tailored to the person. In other cases, it's important for persons in which that process you're discovering what is happening. This is going to be very necessary and rigorous. In rare illnesses and low prevalence illnesses, the psychological support is a powerful need, and even more compared to other situations, because the low prevalence illnesses acts like a stressful element. I'm not going too fast, right? So in this first moment in which we are working with certain events, news that have an impact in a very powerful way, we cannot just set aside this companionship activity or psychological companionship. Some families will tolerate well all of the changes, and to other families will be more difficult. So the interventions that we carry out have to be tailored or adjusted to each of the processes. So the geographical thing, I think it's going to be interesting to talk about a bit later. So we are going to apply a biopsychosocial approach. It's the neurobiologician mentioned about this. We are going to start on the more biological side. There's a gene that's not working. It's not being developed the way it should. And this has an impact at the level of what we are seeing and what we are observing. To ignore some of these things means that we will not be addressing this in a comprehensive way, because this is going to have a repercussion in the quality of life of the person and also the family. We cannot set this aside. Moreover, we are going to see that some psychological factors, neuropsychological factors, are going to be the precursors, are going to be the spearhead of the neurological changes that may happen in the future. And also the social factors, the environmental stress is going to have an influence on the expression of certain characteristics or the enhancing of certain symptoms. That's why we need to have this comprehensive approach, the biopsychosocial. The psycho is also important. Why? Why be specialized in rare diseases. This does not exist by itself, but you can have a specialization in this because it's quite broad. When we are addressing this kind of problems, we encounter a person that, if we are talking about a neurodevelopmental disorder, is going to have some symptoms since this person's born. Like, my kid is not doing this that the others do. So we need to know about the different benchmarks of the development of the life of a person, the evolution when you're youngsters, what's the typical thing and not the typical thing, but also in family relations, how's the family system. In psychology, we tend to specialize ourselves in just one area, and this open regard, this general regard, is not so frequent as we would love it to be. We can also address the health side, the clinical side, and move to more neuropsychological, forensic side to be able to work in some courts, medical courts, to see if this belongs to this or not. So it's necessary to have a broad experience and knowledge. So this is something that's going to be very important for these professionals. I say that they are neuropsychologists and they are rare. And also there's a lack of information, same as for the families, the professionals that we work in this daily life of the patients. We encounter ourselves in situations in which we are missing information to be able to address the different profiles behind the pathology, the illness, or the condition that we're talking about. This generates uncertainty, and for us it's been very important to rely on the official School of Psychology of Madrid to be able to support ourselves in this aspect. Also telepsychology or remote psychology. So one of the characteristics among these rare diseases is how far away they live from each other. So me as a psychologist, me in my city, in my area, in my neighborhood, maybe just have the chance to have one patient. But if we take a look at all of the groups and all of the families, then we start elaborating all of this specific list of needs that they have. So remote psychology, online psychology is going to be a very important tool that is not always well received. Just as a curious thing, during the pandemic, this had a very huge impact, and we were still working with the normal methods with our families. So that impact that many professionals lived, for us, it was not such. Also, the professional isolation, I mentioned this before, with the lack of information and the constant need to adapt yourself. As the families need to adapt constantly to the changes that may arise, as professionals, we need to adapt to all of the situations that may arise. Because sometimes they cancel a meeting because the previous night has been horrible and we've all sleeping, so this could happen. I'm talking about this example, or maybe we need to go to the hospital, there's been an emergency or an emotional process and we need to stay home. So to understand this and not to not enter into an ego battle, it's going to be very important to understand this kind of rare diseases. This is a sentence that someone told me in a meeting, in a session, with a patient with FSHD, which is, she came to the consultation with me and I asked her, why do you come to therapy with me? Because you have your psychologist. And then she said, in you, what I find is that you understand me and I find hope. So there's a lack of upskilling here, and sometimes we don't understand the very big picture. So just by the experience of working with some families, we're able to have this kind of background. So we want to do this companionship with a person, with a family, since the first moment the symptoms starts till the end, even afterwards in the follow-up of the grieving, all of the process. So we're going to do a prevention, diagnosis, treatment, and rehabilitation. And it's going to be very important that we are able to rely on special professionals and specialized. Because later they come and they say our therapist decided to set aside my case, and then these people are frustrated and we're also making them waste money. Specific goals will be the adaptation. We want to adapt to the situation. And for that, it's going to be necessary, depending on the family situation, to develop certain abilities to face things. We want them to emotionally improve. We want to prevent, identify, and treat certain psychopathological modifications. So this figure is going to be very interesting in the detection of and creation of social and family supports to avoid isolation. And here the associative world is going to be very interesting. It's not the same what I can achieve by myself, but what I can achieve with the experience of everybody around me. Because the idea or the way someone does to address something is not the same that compared to the others. So with information of everybody all together has a better impact in the families. When it comes to the cross-sectional side, the figure of the psychology is also going to be necessary to help the person to be able to translate that information that sometimes all of the professionals, doctors, researchers are trying to convey. There's an effect in which we are in shock in the consultation of the doctor and we are not able to put into words what's happening. And also what we said, to give the testimony and the idea for the families, and also to treat things like, for example, this treatment has been very tough, or I'm very tired to do this controlled trials. So we're there to maintain their spirits, and this is going to be interesting. Autonomy and rights of the patients. Sometimes we don't know the rights that we have as patients or relatives. So it's going to be, this is normal. We are trying to do many things at the same time. So to have this support, this regard in which we can know our rights is going to be important. A patient the other day said that she requested a report, and the psychologist didn't want to print this report. And there we can help. Like, you ask for a not a forensic report, but a psychological report, because it's basically what they can do. Is to help the patient to be able to exercise their rights. It's going to be fundamental. And lately, the cooperation and coordination with other professionals. I need to know that if in physiotherapy the day has been good or not, or maybe the person has had some problems, so that we can adjust ourselves and readjust and help the families to adjust their daily life. Is going to be very important. This is the most important part. And when it comes to low prevalence illnesses, we are going to undergo certain stages, the suspicion of the diagnosis, then the diagnosis, stabilization state, the crisis, and then the grief. This has to be understood in a broad way. At the same time, we're going to be developing certain psychological phases: uncertainty, isolation, reject, and adaptation. And I want to put them like this because I'm going to be developing them linearly, and I want you to see the process. So when you suspect about the diagnosis, something's not working. Manuel talked about this before. Something's not working, and the families, you are the first glance, and you are the first ones in realizing that it's necessary to take a look at that. So that suspicion, when it comes to diagnosis, generates certain symptoms of anxiety that could be more difficult. It is typical that we encounter certain cognitive biases. This means certain ways of thinking. And one of them could be to anticipate yourself. So here it's going to be very important that we try to live in the present and don't try to go just beyond. And for all of these things, we can help you. The other day, we have done certain sessions with a patient. She has been detected with several lesions in her brain, and they were saying to her that they had to wait for a year to apply the following diagnosis test. Sometimes the symptoms are common to other illnesses, and we need to clarify this a little bit more to be able to see what's there. So to wait for a year to see if I have certain lesions or not, this is going to cause me anxiety and some cognitive biases. So to help this patient to live in the present, to stay in present day, is going to be very useful. It is true that she was a professional of the also health sector, and with a bit of psychology, we were able to improve her situation. We're going to detect certain symptoms, psychological and neuropsychological symptoms. For some conditions, neuropsychology, this feeling, are going to be also a reflection or an anticipation that changes are being happening. So it's an early detection is going to be useful to apply these techniques that exist to reach the diagnosis. Also, the companionship in the medical process, it's here because there are so many appointments. The information, it's huge. So to be able to share this with someone that helps us, that supports us, that guides us, it's very, very helpful to us. So basically what we do in this stage is to generate this internal control locus, which is basically to contribute to control the things that we can control. And if we are worn out by the things that we cannot control, we're going to have a problem in the future. When it comes to the diagnosis, maybe we are emotionally fatigued. Before, it was said that in an average, the further studies take 8 or 9 years to have this diagnosis. So to 6 to 8 years, it's in the best of the cases, and in others 20, and in others less. So families, we all already have this fatigue, and until we encounter the diagnosis, and this generates different emotions. On the one side is relief, like finally we know, but on the other side it's like, damn it, basically we have the confirmation of this illness, and maybe it's not what we wanted it to be. So here we have a grief process, a grief for the expectations that we had, because we need to understand grief in a broad way. We need to reconstruct everything we wanted to have new goals, and sometimes this process is not so easy. And I say that you are like researchers or investigators. Like before, they told us what was like to be a mother or a father, but now nothing's the way they told us. Suddenly, everything changes. Like, for example, the food we have to give them, or the process that we need to follow, or the way they should breathe. It's like so many things. So it's very important that we adopt this glance of the inspector, of the researcher, and try to see and discover what these new things are. This could be in the family encounters or family meetings, because the expertise of others could be helpful. And this, we try not to focus on the illness, but to focus on the person. What does this person love? What does this person enjoy? The temperature of the water in shower, or the toys he or she prefers. So it's necessary to be curious in a moment in which we could be damaged, but we need to have this curiosity towards the new things for our kids. So we move from this idea of helplessness, of this idea of what's not going to be, to the idea of what it's going to be. What can we do? Where can we place that strength? Then we have this stabilization phase. I don't know if you are able to identify yourselves on where are you at. You defend yourselves. It's basically we are able to do it, better or worse, but we do it. And this is a sandcastle here, because in these cases we can build a castle in the seashore and then wait for the waves to destroy it, or we can focus ourselves into building walls or building ditches that could improve the process of the symptomatology of the illness. So this routines, this way of behaving with a sharing the different responsibilities is going to be necessary. Also prevention and care towards the carer or the caregiver. I don't know the situation you may have at home, but I encountered that one of the two members of the family must quit their job to dedicate 100% to the person. So to help this person, this carer that's leaving one of its roles, is like the professional side, being able to develop others, like me and my role in the family, my role with my friends, or my role in some other area. It's going to help us prevent this warring of the identity of the carer that usually happens. Later, when we achieve this stabilization process, there's a crisis. A crisis understood as a change. There's an acute element of a change, and this could make us go back to this anticipatory bias or anxiety. So we adjust ourselves in each stage to see what's happening. And then about grief. Grief understood as a broad concept. I'm going to highlight a little bit the last element. It's the relief and blame. Sometimes when the person dies, you feel relief. You feel relief not because the person has died, but because the excess, the burden that we were having, to understand that it's due to this and not because we don't love our relative is fundamental. Not to develop these feelings of to try to blame yourself or guilt. And with all of the different nuances, the process in which we are all living is basically this. So what's happening at the psychological level? During this suspicion of the diagnosis, we are in this uncertainty process, and the uncertainty feeling is the one that we love the least. Like, for example, when someone tells you someone's been speaking about you and you don't know what they speak about you, you feel this uncertainty and basically you don't like it. So it's just like this. You're in this situation in which you don't know what's happening. How many of you arrived to the doctor consultation and tell them what's happening? And then you say, okay, is it me, the one that has to teach you, or is you the one that has to teach me? And all of this generates complex emotions and uneasy emotions. So there are techniques to address the symptoms, and it's going to be very necessary to anchor ourselves in the present day. We're going to find 2 profiles that we must reconduct to another one. We have the profile of the avoider, which is the person that tries to avoid, they don't want to know. The information is such that it's overwhelming to them, and this can have a repercussion in the way of living of this person. Because sometimes we need to make some decisions. If to, for example, to tell the family so that all of the family conducts a genetic exam or not, and the amplifying profile, which is the anxious one, in which you need to know, you need to do researches, you need to read, see more information, and there the times or the timetables are not the ones that we need, and we need to relax ourselves. There's another stage in which you don't know what's happening. I don't know if you before heard about the rare diseases. So we are entering in this stage, in this world of confusion or consternation. How could it be? How is it possible that the doctor that has to attend my case is in another city? So there's many news that have an impact on us when the diagnosis arrives. It's important to adjust the information to be bit by bit, helping the person to be able to accept them. And that's why we need the specialists. For example, in one case, there were 3 kids, one of them was affected, and they didn't let this guy to touch the baby because they thought that whatever he had was contagious. So it's important to receive information, proper information, to prevent any kind of misinformation, and also to favor with the professionals the communication to flow and to help with any commitment. Opposition, isolation, in this crisis period, we need to understand that these emotions are necessary. To try to deny we need to understand that this process is to understand what's happening. This means that we need time. Rage, it's a defensive emotion, and well channeled is going to boost us to achieve or seek for our own resources to improve the environment. Here it's going to be important that we maintain limits. Rage could be violence, and we cannot tolerate this. And then the sad element, sadness, it's just an anticipatory feeling of the adaptation. Basically, we enclose ourselves in ourselves. We don't want anything from the outside. We need to process, to resolve, and to reach conclusions. This is the adaptation process. It's the relaxation. We can look back, recognize the losses, but also take a look at the new opportunities opening in front of ourselves. And obviously, it's not only the person. We have the impact in the whole family, because rather than the diagnosis for the person, the diagnosis is received by the family. So, to take care of the carer. For me, the carer has the most important job. I had prepared a lecture that I'm not going to do it, but basically it's a work in which we are all the time, 24 hours per day, 7 days a week. The person's life is at risk. You cannot rest. Disabilities don't disappear. So if any of us were offered a job position like this, you would say, not ever, because I do have rights as a person, right? So with the appropriate tools, we can face all of this, but we need to have the tools. I want to mention the siblings. the siblings usually are invisible in this process, and it's very important that we're able to explain to them what's happening, because at the end they do sometimes they are set aside and they need to understand, because if not they're going to develop certain cognitive biases. But also we give them, on the other side, we make them in charge of the little brother, and they are just siblings. They are not the second parents. Also the family relations and the impact on the couple. You know what I'm talking about. It's something that you have all lived, but we also find spaces like this in which we can make these support networks grow and expand. And lastly, I wanted to share a video which I think it summarizes pretty well where we are at.
Cuando vas a tener un bebé,
when you're going to have a baby, it's like planning some holidays. Is that trip to the beach that you dreamed about? You're finally going to go there, and then you start buying books and guides to see where to go. You think about walking in the shore, drink some martinis, everything. It's exciting. Finally, the day arrives. You prepare everything, and there you go. Several hours later, you see the forest. Welcome to the mountain. The mountain? But I was going to go to the beach. And it takes time to assume this, but you start thinking that the place is not bad. It's just different. If you complain that you didn't go to the beach, maybe you are not free enough to enjoy the nice things of the mountain. It's difficult for me to see this video without feeling moved. Well, maybe the way or the path that we need to follow is not the one that we wanted to follow. Maybe you love more the beach or the mountain, but with the appropriate resources, with all of the professionals that we are part of the support network that we want to give to you, we can achieve that this adaptation and that this change of destiny is something that we can enjoy. Thank you.
Uf, con qué poco se puede decir tanto, ¿eh?
Wow, you said a lot with not so much with that video. Any question? Do you have any question?
Lo que yo conozco de enfermedades.
So for what I know with rare diseases, when I talk to the families, I see two important elements. One is uncertainty. When at the beginning you see something that's not working, that uncertainty period. And then I also see a transformation when this uncertainty has a name. And then you see you found a group, you found a tribe. As Dr. Schaaf said about his patient in the United States, you find a tribe in which basically you find a big family which is diverse. As you said once, they are from Galicia, from Cadiz, from different cities, but you feel embraced. These are important aspects, not only to find things and tricks and information, but to find someone that's able to understand what happens to you. And yourselves, that you're specialized in rare diseases, is even better, because sometimes life can give you too many lemons, so sometimes it's necessary to find your support, and you're super necessary. Does anybody have any specific question or ask for any piece of advice or anything on any relation?
Si no subes aquí conmigo y te dejo el micro, ¿eh?
The interpreter apologizes, but we cannot translate what she says if she doesn't use a microphone.
Te está escuchando.
Mi hijo tiene 11 años.
My boy is 11, and he's starting to punch people or kick other boys. So I think it's about communicating. When he's not able to communicate, he starts hitting each other. I think the solution tomorrow is going to give some medication or drugs to these cases. For the moment, I always think the later the better. So is it the neuropediatrician, the one that prescribes you when there's no other solution because he's all the time hitting the others? I always say medicine for the doctors. I am a psychologist. But at the end, you say that your boy is not communicating, and the way he is actually communicating is by hitting. He doesn't have the verbal language, but he's communicating. That's why I said you need to turn yourself into a researcher. It's like, what happened? Did he change school, class? It's basically he doesn't want to go to school because he's better at home doing nothing. I don't know, it's in a special school. So basically we need to understand what's happening and why understand in past year this didn't happen and this year is happening is going to be interesting. So when it comes to drugs, whatever the doctors say, I'm not going to be able to answer on that side. Yeah, no, my question was if maybe the older, the better. It depends, because sometimes we say that the treatments need to be tailored. So if there's a moment in which certain treatment is going to be important, maybe we need to use it. For me, everything should be psychology, but that's not what we all need. In an easy way, sometimes we're able to progress a lot. So we need to analyze each case, analyze the needs in families, in the person, and then be able to decide whether to use one treatment or the other.
Hola, sí, mira, un problema que
There's many families that have a problem when we're choosing the professionals or treatments. Depending on the place you live, the options are quite reduced. Not everybody lives in the capital city or where there are many options. So I wanted to ask you, how do you think that we could evaluate the effectiveness of a treatment when you are with a professional? For example, there are problems easier to evaluate where there's direct evidence of an improvement or a situation that gets worse. But when you need a treatment with a lot of time, maybe you can have your kid with a psychological treatment during a long time. So how can you evaluate the effectiveness of that treatment that requires a lot of time? How do you measure this and say, okay, this is not working, we need to change strategy, we need to wait, we need to change the approach, especially in the kids in which communication is difficult to communicate. As she said before, it's not non-verbal, and communication in both sides is much more difficult to interpret. Are we talking about a specific therapy here? No, nothing specific, but well, in my case of my boy, we didn't try psychological therapy, but we did try other kind of therapy, occupational therapy, logopedia, and psychology. It's something that I think parents don't understand that much. It's difficult to evaluate the progress. You don't know, for example, our kids, the ages they are at, they change a lot. It's difficult to say this is an improvement due to this therapy or not. It's difficult to measure. So in my case, we never used psychology. We didn't have severe behavioral problems, but we see this difficult. We don't understand if it can be effective or not. And when we need to choose a professional, how could we evaluate this as parents, if this is going to be effective or not, if we need to change, if we should approach this in a different way? It's very difficult to establish some objective criteria because they are not there or we don't understand them. Okay, I understood. At the end, how we observe this progression in a physiotherapist, in the logopedic therapy, or in any professional, basically we are applying a science. There's an evaluation and there's a treatment. Based on this evaluation that we do is when we are going to start seeing in which stage, in which moment we are encountering ourselves to be able to intervene. So there is going to be cases in which the evaluation is going to be objective through the tests, through questionnaires, through surveys, or different executive functions. Maybe we can put some other example, like for example, when it comes to attention, if the attention span or the ability that we have to remember was of 7 and now it's 5, it's been reduced. So the situation's getting worse. But if now it's of 12, we can say it's improving. So these surveys or the tests, we psychologists, we are all there taking our papers to conduct exams. This is easy for us to be able to make this process a little bit more objective. And when it comes to the emotion and anxiety test, a depression test, there are some situations in which, due to the circumstances, I may not conduct this. If you come crying, I can see that you're sad. So I have this behavioral evidence. And if I ask you and you said now you cried twice and yesterday you cried 12 times, I can see also, I can measure, there are some evidences and there are some formulas to see the variation. And as families, we can request, we can demand this. I mean, you have the right to know if this treatment is being effective or not. Sometimes it's quite slow, but yeah, it's true. Thank you. Any other question? Well, your contact data or your team, I understand it's in the webpage of FEDER, where you can send an email. You have the webpage over there. So if someone's interested, you can take note of this, and I think you can encounter your data on the webpage to define this. So thank you very much for this interesting presentation.